What happens when we do not treat the defect? We only think about the implants. Here's a young patient. She's 28 years old, beautiful young lady. You can see that she has a deficiency in the lateral area because of congenitally missing teeth. And rather than augment the ridge, two very small diameter implants were placed, micro implants, 2 millimeters, were placed in the area, and eventually these implants fractured. Here's some pink material that was added, and you can see that this is unattractive. When the patient smiles, you can see the depression in the ridge, a darker color, inadequate soft tissue augmentation. And what are the restorative implications of regenerative enhanced prosthetic results? What happens when we try to perform surgery without grafting it? What we end up with is just anchors that are unattractive, that are unaesthetic, that are prone to fracture, poor biomechanics, and for this patient, the interface development between the lips and the gingiva is inadequate because of her smile line. Look at the concavity in the ridge. When we don't augment the ridge, we have a darker color. We have a ridge lap pontic. It does not look like the teeth are emerging from the root. No root eminence. To me, this is failure of diagnosis. This is a type 2 case. So I share with you, again, this is a 2 millimeter implant that's fractured. I take it out with a trephine drill. These were one-piece implants. So really I couldn't use the implant removal kit, fixture removal kit from Neobiotech. And you can see I have to damage the bone when I take it out. This is all healthy bone that has to be taken out with the fractured implant. Taking out implants, unfortunately, although we all do not want to do it, is a necessity of an implant practice today. We must know when and how to remove implants in the most atraumatic way. And the way that I do it today is using the Neobiotech Fixture Removal Kit. And this is another very well engineered and planned series of components that work exceptionally well. I implore you, if you ever have had a problem removing an implant, this is the solution. You engage the removal screw into the body of the implant, 32 Newton centimeters, and then the counter screw for the removal tool can go up to hundreds of millimeters of counter torque, Newton centimeters, counter torque, to actually deintegrate the implant. So the Neobiotech Fixture Removal Kit, and you see a lot of these products featured along the wall today. I use most of them. And you can see this implant is being removed by just simply back threading, removing it without any damage. Look at this socket. It looks like I've just bone tapped the site. It looks like the day of placement, a lot of the day of removal, is a bleeding area. You can see the threads. The labial bone has been preserved. I have not damaged it. And when I take out the implant, you can see that this is the process. This kit comes out, it attaches around the top of the implant, and it allows me to remove it without damage, without fracture, and without loss of autogenous quality bone. This is the kit. This is one that I use in my practice whenever I have to remove an implant. They have a similar kit for the screws if the screw of the implant breaks, which also works quite well. And I suggest that if you haven't used them, you should take an opportunity during the break to go over to the exhibit area and take a look at the systems. Again, maintenance of the bone around the removed implant. Very critical. It makes much easier for us to either replace the implant or to graft the site if the labial bone has not been damaged.